Wet versus dry suction techniques for endoscopic ultrasound-guided fine needle aspiration of solid lesions, a multicenter randomized controlled trial. Introduction. It has been well established that endoscopic ultrasound-guided fine needle aspiration, EUS-FNA, provides tissue diagnosis as the standard of care for pancreatic, mediastinal, and abdominal lesions, with the diagnostic accuracy ranging from 78% to 95%. However, EUS-FNA has limited diagnostic value for lesions such as neuroendocrine neoplasm, lymphoma, and autoimmune pancreatitis because of the lack of a sufficient specimen for further immunohistochemistry, IHC, staining, or biomarker assessment for targeted treatment of these unresectable tumors. Although the author's previous study showed that the fine needle biopsy, FNB, approach improved diagnostic accuracy, FNB needles may be more expensive and are not as widely used as FNA needles in some institutions. To improve the diagnostic accuracy, suction techniques for EUS-FNA have been developed and are widely used among operators. These suction techniques require removing the stylet and subsequently placing a syringe to generate negative pressure on uptake of the specimens. The so-called dry suction technique requires puncture of the lesion, removal of the stylet, and then placement of a pre-vacuum syringe. It has been reported to increase cellularity. However, applying dry suction enhances the chances of blood contamination and therefore hinders accurate cytological interpretation. Later on, the traditional wet suction technique was developed to overcome this issue. It requires removal of the stylet first, then pre-flushing of the needle with saline, and subsequently placement of a 10 milliliter syringe pre-filled with 3 milliliters of saline for aspiration. It is reported that the technique may increase the cellularity and adequacy of specimens without adding blood contamination when sampling solid lesions. More recently, the wet suction technique was developed with a modification that involves placing a 10 milliliter syringe without saline loaded to maximal suction to combine the benefits of the wet technique for needle preparation and the dry technique for suction syringe preparation. A pilot study of 15 patients highlighted that this wet suction technique achieved a larger volume of aspirate compared with dry suction. Owing to the limited study sample size, there was insufficient evidence to prove whether the wet suction technique could improve sample adequacy and the final diagnosis in comparison with dry suction. Therefore, Wang et al. Designed this multicenter randomized controlled trial to clarify the effect of dry suction and wet suction on pathological specimens obtained using a standard 22-gauge needle. Background. The optimal sampling techniques for endoscopic ultrasound-guided fine needle aspiration, EUS-FNA, remain unclear and have not been standardized. The aim of this study was to compare the wet suction and dry suction techniques for sampling solid lesions in the pancreas, mediastinum, and abdomen. Methods. This was a multicenter crossover randomized controlled trial with randomized order of sampling techniques. The 296 consecutive patients underwent EUS-FNA with 22-gauge needles and were randomized in a ratio of 1:1 into two separate groups that received the dry suction and wet suction techniques in a different order. The primary outcome was to compare the histological diagnostic accuracy of dry suction and wet suction for malignancy. The secondary outcomes were to compare the cytological diagnostic accuracy and specimen quality. Results. Among the 269 patients with pancreatic, N equal 161, and non-pancreatic, N equal 108, lesions analyzed, the wet suction technique had a significantly better histological diagnostic accuracy, 84.9%, 95% confidence interval, CI, 79.9% to 89.0%, versus 73.2%, 95% CI, 67.1% to 78.7%, P equals 0.001, higher specimen adequacy, 94.8% versus 78.8%, P less than 0.001, and less blood contamination, P less than 0.001, than the dry suction technique. In addition, sampling non-pancreatic lesions with 2 passes of wet suction provided a histological diagnostic accuracy of 91.6%. Conclusions. The wet suction technique in EUS-FNA generates better histological diagnostic accuracy and specimen quality than the dry suction technique. Furthermore, sampling non-pancreatic lesions with 2 passes of EUS-FNA with wet suction may provide a definitive histological diagnosis when rapid on-site evaluation is not routinely available.